A vaccine is a biological preparation that provides active acquired immunity to a particular infectious disease. A vaccine typically contains an agent that resembles the disease-causing microorganism and is often made from weakened or killed forms of the microbe, its toxins, or one of its surface proteins. The Tertiary Education Trust Fund, as part of its paradigm shift towards research and development, has not only been working to make the case for continual increase in research funding, but also for the implementation of a triple helix model, with the government, the industry, and the academia working together for technological advancement. As part of its medium to long-term efforts to counter the COVID-19 pandemic, TED Fund commissioned 6 research and development programs and projects aimed at drug discovery and development of the candidate's therapeutic, diagnostic tools, ventilator, and repurposing of drugs. The National Food and Drug Administration and Control, that's NAFDAC, University of Ibadan, Usman Danfodio University, the University of Kano, Nnamdi Azikiwe University, and the Kaduna Polytechnic were all funded solely for this purpose. As a prolific researcher, TED Fund's executive secretary, that's Professor Bogoro's professional instincts, were promptly alerted by COVID-19, refreshing his well-considered conviction that research on problem-solving suitable for our Nigerian content and the environmental growth are the best options for industrial development. Determined to ensure that Nigeria is listed as one of the African countries with the capacity for vaccinology, TED Fund structured a special intervention to change the narrative. 3 national institutions were given priority for vaccine development. They are the National Medical Research Institute in Lagos, the National Veterinary Research Institute in Jos, and the National Institute for Pharmaceutical Research and Development in Abuja. As Nigeria intensified its quest for local vaccine production, drug development, and gene sequencing, 3 of its universities undertaking research in the areas have received the World Health Organization certification for advancement to the next stage of their research work. Additionally, TED Fund has approved 6 COVID-19 research grants to the tune of over 200 million naira in support of the Presidential Task Force, that's the PTF, on COVID-19. For Nigeria to be able to produce a vaccine, the intervention from TED Fund must be a perpetual initiative. Nigeria must think long-term in 25-year cycles, and billions must be spent for scientists in the country to continue to undertake research and development in our medicinal plan, and then we'll be able to come up with our own vaccine. Nigeria's companies and the private sector should also step up to fund research and development in Nigeria, as the government can simply not do it alone.